On the line?
Yes, coming up, we have a question from Dean regarding OHIP Plus. Dean, you're now live in the line. Can you please go ahead?
Hi, guys.
Hey, Dean. Welcome.
Hey, my question, you guys, I think, just answered my question pretty much, but I guess maybe I'll change it slightly because you did answer most of it. But Joe, your opinion, I mean, we've had this government less than 2 weeks, and, typically pharmacy goes to government almost begging and pleading to hear our cries, whereas, we've seen this government actually proactively come out and I probably identify something that fundamentally we knew was wrong right from the start. And, the Wynne government, looking at, probably the wrong people to save some money on healthcare costs and that sort of thing. So I guess, Joe, and almost anybody could answer it, is really like when you see something like that comes out so quickly as an announcement. I mean, that was probably the most surprising thing that, all of a sudden, Christine came out and said, you know what, we need to change this program. It's wrong. So, like I said, you guys answered most of the question, but I just sort of like your opinions on that.
Well, I can start if you like. I mean, I think that pharmacists and pharmacies should be encouraged by the fact that the PC party in its election platform, when you get to the health section of the Progressive Conservative Party platform, put in writing that they will be seeking the input of frontline healthcare workers when addressing the healthcare issues in Ontario today. As you've both articulated, no one is more frontline than your community neighborhood pharmacist. So I think that's encouraging. It became clear then with the timing of it that the universal OHIP plus coverage model was not one that the Ford government was likely to continue to support. But I think as well, given that it was June 30th and there was some agreement or understanding with the insurance, the benefits carriers, you both can speak to this better than I can, that something changed on July 1st, so it was actually necessary to come out on that day. Am I right about that?
Well, there was a bridge that was provided by the private insurers on exceptional access program, and I do think that that plays a role. But that said, there's not a clarity around what's the timelines, what kind of transition are we looking at. So I think there's some still detail that we need to understand. Is the government going to be a second payer, as an example? So there's still some, certainly discussions that need to happen with the ministry. We have a commitment that there will be a consultation and that we'll have input into both the transition back and more detail. But I think they're certainly getting out in front of it because it is an issue. And there was, certainly a cohort of the population that was having some challenges accessing medicines that they were covered for or had coverage for before and no longer had that coverage. So I think it's important to get it right, to take the time and to go through the consultation. There's undoubtedly going to be some challenges, but we need to work as a collective to get it right.
If I can just add to that, I think it's the hope that we have for this government. I think it can be seen with, with this announcement from Minister Elliott. It demonstrates that there is a receptivity to some of the challenges, Justin, that you had addressed. We know, as those frontline providers, that are right at that point where patients are being impacted. The delays that we saw with limited use, the delays that we saw with claims that had to go through exceptional access programs, which just, quite frankly, made no sense. It was very much, like Dean, like you said, it was a system and an approach that we knew was flawed right from the get-go. So there's this hope that the government is receptive to what they've heard, perhaps from their discussions with patient groups. And we're very hopeful now that we have a little bit of, not a whole lot of time. It sounds like they want to move on this matter, and so we're very eager to engage the ministry in these discussions.
Good. Thanks for your question, Dean.